Dental veneer is a restoration. The process is to change the shape or the color to a desired shape or color that the patient wants. It's about a ½ millimeter thick piece of porcelain that we specially make to the shape that we want and to the color to alter the appearance of a tooth. A dental veneer is usually something a patient desires. We can do a veneer if a tooth has some decay in a certain area. It's a little bit bigger than a filling requirement, but a veneer does two functions. It changes shape and color. It also allows us to restore a tooth minimally invasive. Of course, we got to diagnose and talk to the patient about what they want and need. They select a veneer. The patient has to be comfortable while we're working, so we do have to numb. And then we just prepare the tooth. We have special measuring things that we use to prepare the tooth to take the required amount off the tooth for the right thickness of the porcelain veneer, the ceramic veneer. Then after that, patient leaves for a couple of weeks while the lab makes it. Veneers are very technique sensitive to make because a lot of them are pressed ceramic. So they make some ceramics, they press it into place, and then they bake it. So to get one veneer, they could possibly have to make 2 or 3 or 4 to get one veneer. So they're very lab intensive. Then the patient comes back, we remove the temporary. They might have to get numb again, depending upon if they feel sensitive. Sometimes cold air makes them feel sensitive. And then we cement the veneer on permanently, and then check the bite to make sure that the opposing jaw, upper or lower, doesn't hit it, and make sure that it looks good and feels good to the patient. A veneer can last as long as the patient is taking care of it and has good habits, brushing, flossing, and not chewing hard candies, not cracking nuts open with their teeth, not chomping ice. All the things that you shouldn't do to your natural tooth, you shouldn't do to a veneer or even a crown. But as long as someone is taking good care of them, they can last the patient for decades. The hardest thing for a dentist to do is to create one restoration in the front where it's very visible and match the adjacent teeth. So typically if we're doing a single restoration, we have the lab get involved. We use a great lab out of Colleyville, so the patient can actually physically go there and the lab technician can work on that one tooth and create the right look for the patient and match those identical. If the patient has a desire to do more than one, that becomes a little bit more easier job on the dentist. But if we're still staying in lower numbers, we always talk to patients about doing even numbers of veneers. It's more aesthetic. We can use more shape by using a wider area to control shape and color. 2 to 4, we can get away with a lot more, and the patients are always happy because we can do that. One thing we always like to do is if the patient always wants the tooth a little bit more brighter or whiter, we always have them whiten before we work on the tooth and before we make the final restoration. That typically also too helps blend in things. Then we make the restoration to that new color that the patient likes, and then their adjacent teeth over time may darken, but they can always touch up with whitening trays to make their adjacent teeth match.